Hello, my name is Jillian Geiger, and today I'm going to be demonstrating the Z-Track method of administration for medication. Right now I'm in the med room looking at the order for my medication, which is a vitamin K 1 milligram per 1 milliliter Z-Track IM, and it is just one dose. I have already reconstituted my liquid, making sure there's no powder, residue, or anything like that. For IM, I'm going to make sure that my needle is between a 21 and 25 gauge. This needle is a 23 gauge. It is 1 inch in length, which for IM administration, the needles are going to be 1 to 1.5 inch long, and you cannot administer more than 3 milliliters, so this is a 3 milliliter syringe. So what I'm going to do, I'm going to take my medication, get my alcohol wipe, and wipe the top of it. I'm going to let it dry on its own. There was a little bit of residue, that's why I just wiped that off. Discarded it in the trash receptacle behind me. I'm going to screw on the needle. It is 1 milliliter. I'm verifying with my order. I would also make sure that I do have the right patient, right drug, right dose, right route, and right time before I begin any of this. But I'm going to drop my syringe to 1 milliliter, remove the cap, and it is dry now because I did not fan it or anything like that. I let it air dry. I'm going to administer the air into the container and flip it into the vial, and then pull out, draw out. I'm going to draw out slightly more than 1 milliliter because I do have a large air bubble, so that way I can push the air bubble back up. Remove this. Make sure there's no other air bubble. And now I'm going to use the scoop method to recap my needle. I'm going to remove this cap. I would put it in the sharps container, but for the purposes of this demonstration, I'm going to set it down right there. And then I will grab the other needle that I have to administer the medication. Move the medication off to the side. I will open this, take it out of the package, and I will screw it onto the top of my syringe. Now I'm going to walk into my patient's room, verify that I have the right patient, right drug, right dose, right route, and right time, all again. Then I'm going to make sure that my patient does not have any allergies to this drug. I'm going to clean their skin, going from the innermost to the outermost, the cleanest to the dirtiest. And then I'm going to put my gloves on. And when I was in the medication room, I would typically have gloves on, but for the purposes of this video, since I only do have one pair, I will be putting them on now. I'm going to pick up my needle and moving the safety out the way, and then I'm going to remove the cap. And for Z-Track, I will displace the skin with my fingers. I typically would displace it backwards. For the purposes of the video, I'm gonna displace it sideways, and I will go in at a straight 90-degree angle, administer the medication, hold it for just a second, and then remove it and displace the skin. I would typically put the safety lock in place and discard of the needle in the biohazard container, the sharps container, but for the purposes of this video, I'm going to demonstrate the scoop method again and put it back on my needle. Now, if there was any residual, I would tap that with a cotton ball, put a band-aid on it if there was any bleeding. This patient does appear to be fine, no bleeding or anything like that, so in about 10 to 15 minutes, I will come back and check on him, make sure there's no adverse reactions. Thank you.